Morning, everyone. This is Christina Mills from the California Foundation for Independent Living Centers. Happy Monday morning to everyone, and thank you for your patience. We are very much looking forward to and excited to be hosting today's webinar training, Aging and Disability Resource Centers 101. This training is coming to you in part by CFILC and the Membership Association of the AAA's C4A, and as a result of some of the great work that has been done by the statewide ADRC Advisory Committee. Today we have presenters with us from the Ventura ADRC, Danny Anderson from the Independent Living Resource Center, Victoria Jump from Ventura County Area Agency on Aging, and Wilson Tam, who is our Technical Assistant Support staff member from the California Department of Aging that works with us closely on the ADRC Advisory Committee. We also have two special guests with us today that will be talking about their specific models, their local models and ADRCs. We have Anna Acton from Freed Center for Independent Living and Eli Gillardin from the Marin Center for Independent Living. So let's get right into it. Some of you call ADRCs Aging and Disability Resource Connections because of the way the federal government originally defined them. Today we're going to be talking about them both as ADRC federally defined as connections and ADRCs as centers as defined in California by AB 1200. So ADRC community benefits. Historically and currently, many services have been siloed to specifically serve populations of individuals based on disability, income, or age. And ADRCs bring those silos together to create inclusive service and programs. The ADRC model is a no wrong door system that bridges the gap between aging and independent living center services. The interface between consumers and the long-term services and supports, what we call LTSS systems, in order to make it easier for people with disabilities to learn about the how to efficiently access the LTSS options that would best meet their needs. So we're going to cover quite a bit in terms of the basics of ADRCs, but we really want this to be an opportunity for you all to also think about questions that you want to ask that maybe you're an emerging ADRC or haven't really thought about whether or not you want to engage or invest in an ADRC model. And we hope that this training today is the basics and basis for what builds your foundation to move forward. The goal is to increase more ADRCs across California. I'm going to turn it over to Wilson Tam from Department of Aging, to move forward in today's training.
Thanks, Christina. I'll be covering about the California ADRC history and the designation requirement. The history of the ADRC model started in 1999 through the U.S. Supreme Court's Omset decision, which shifted long-term services and supports toward community-based options. Thereafter, in 2003, the Federal Administration on Community Living started providing ADRC grants to states for streamlining these access to community-based LTSS options. Then fast forward to 2006, the definition of ADRC was added into the reauthorization of the Older Americans Act in 2006. Just a couple years ago, ADRC was added by California Assembly Bill 1200 to establish the ADRC program in state statute. Essentially, what's in state statute, it gives kind of the general requirements of the program. The more the detailed designation requirements are actually provided in the ADRC designation criteria, which is posted on the ADRC website. And as part of the California Department of Aging, we're responsible for administering the state ADRC designation process, and we're also here to support you in developing your local ADRC partnerships. So what is an ADRC? With the growing number of individuals wishing to maintain their independence and the increasing confusion and frustration in finding and assessing available services, ADRC is a system to better assist individuals of any age, disability, and income in their decisions. by delivering the right information at the right time about the available long-term services supports for their choices of care. And what is needed in an ADRC? The primary components of an ADRC includes partnerships between the area agencies on aging, the independent living centers, and other partners in your community. Another important component are the core services and having the no wrong door philosophy. We'll be actually going over these components in greater detail in the following slides. So I'll be turning over this to Victoria and Danny from the Ventura County ADRC to tell us a little bit about how does a fully functional ADRC look like.
Thanks, Wilson. From a AAA viewpoint, it was important to us that our partners share a common vision and philosophy. We started down this path when we had to be ready as a AAA to fully embrace the concept of no wrong door services in all of our programs. We also had to be truly ready to change and embrace serving people of all ages, not just older adults that we were accustomed to serving. This required that we change who we were to our community, our advisory council, and our staff internally as well. We had to work to break down our silos between our own programs internally so that we were truly a no wrong door system. We also had to adopt a person first philosophy that was a change for our staff because we are, aging specialists. We were used to doing things for people, not encouraging the independence throughout the lifespan. When we started down this path, it was not an overnight process. It took us a couple years to get where we are.
Thank you, Victoria. And this is Danny. It was similar for us. We had to adjust to serving a much older population and consumers with different needs. One of the things that we have found is that just because you're an ADRC on paper, it doesn't mean that you're a functioning ADRC. There is a difference. We have shared goals and the same philosophy as the AAA. We've also found that communication is key. Communication between the directors and the staff at all levels. We want them to work together to share not only individual expertise, but resources as well. To foster an environment of communication and continuous learning, we have joint team meetings and trainings, as well as shared processes and procedures. We also work to lift each other's organizations up by inviting each other to the table to meet with other partners. This goes back to the shared philosophy. As a fully functional ADRC, we do not see barriers or silos between our organizations. So in all discussions regarding long-term services and supports, we want to make sure that both of us are at the table.
We also share a commitment to the ADRC beyond signing an MOU. We are truly partners and are committed to the growth of our center. Locally, this has meant that whenever either organization applies for a grant, we automatically think of our partner and how they fit in and what services they can provide. It's also a commitment from the other organization in that they need to be willing to grow their organization in other directions in response to the need of the community. Bottom line, it's also a shared commitment and consistent focus on the consumer. We make sure that we are providing warm handoffs between core partners and our extended partners.
It has to be person-centered, using a no wrong door approach.
So thanks, Victoria and Danny. So another important component, in addition to what Victoria and Danny had mentioned, is the importance of having extended partners. Extended partners are typically, based on the needs of your community. The more extended partners you have, the stronger LTSS system you have. And with extended partners, they provide the ADRC core services and other needed services that are needed in your community and what's determined as a need. And just like the core partners, extended partners also share the same protocols for warm handoffs. And what we mean by warm handoffs is, not only referring individuals to a service, but actually personally walking them through the process, helping them apply, and helping them get connected with the services that they need. Some of these examples of extended partners include housing providers, senior centers, regional centers, veteran services, transportation providers, and partners from healthcare, such as home health agencies, community clinics, hospitals, Medi-Cal providers, and nursing facilities. Victoria and Danny, did you want to talk a little bit about the core partners that you have and share some examples with us today?
Sure. So really, when thinking about extended partners, think about big picture of anywhere somebody would access a system that would need some kind of service to live independently in the community for as long as they're able to. So some of our partners in Ventura, we have housing providers to include public housing organizations as well as assisted living providers. We naturally have senior centers. Regional centers are also a strong partner. For veteran services, we have 2 military bases. So we also partner with the active military bases. And also we have a large military collaborative that we partner with, as well as the Veteran Service Office that most counties have. For transportation providers, it's beyond just, who provides the rides. Think about also who does the travel training in your area and who does the ADA certification, because those are actually very powerful partners to have, because you'll find that you need those more and more. For our healthcare partners, we have the traditional partners. We have a lot of partnerships with home health agencies, ambulatory care clinics in a variety of systems. Nursing facilities are also our partners, as well as the long-term care ombudsman, and also our local county organized health system, which is our Medi-Cal managed care organizations. They're also at the table. We also make sure that the agencies that provide public benefit are also our partner, because we get a lot of referrals there, such as Medi-Cal and CalFresh. We've also included locally adult education programs and our workforce providers as well. Many counties have caregiver resource centers or caregiver centers. They're also partners. We also look for disability-specific partners, such as brain injury centers, ARCs, Alzheimer's Association. Those kind of organizations are also, powerful extended partners. Recognizing that food insecurity is an increasing issue for people of all ages, we've also included food partners such as Food Pantry. We make sure our senior nutrition program is at the table. And we've also have adult day health care and social model adult daycare partners, just to name a few.
So thank you, Victoria. So I'll talk a little bit about another important component of ADRC are the 4 core services. One of the services is the enhanced information and referral services, and other assistance at hours that are convenient for the public. The second is options counseling concerning available long-term services and supports programs, and public and private benefits programs. Third, we have short-term service coordination. And fourth, transition services from hospitals to home and from skilled nursing facilities to the community. You may already be doing many of these services, and that's great. The keys to really becoming a successful ADRC is how exactly these services are aligned with the philosophies of no wrong door, your processes to streamline access to services, and person-centered concepts. There may only be minor differences between your existing services and ADRC core services, and we're hoping to be able to maybe clarify some of that today. Victoria and Danny, can you share how you provide these core services, and do you have a separate staff person that provides each of the core services?
Absolutely, Wilson. We've trained our staff in our ADRC that provide the core services to work together and provide those services seamlessly. Victoria is going to give you more information about that.
Sure. From the moment that we take a call, enhanced information and referrals provided, which often leads to options counseling and short-term service coordination. For transition services, we have separate staff that work on transitions. Due to having another program in place that handles transitions from nursing facilities to the home and also from congregate living facilities back to the community. The core set of services are not a separate set of services all the time. So the short answer is many of these functions are shared by one person who does it seamlessly.
And this is Danny again. I'm going to go ahead and introduce the examples of local ADRCs. In talking about the Ventura ADRC, ours is an example of a brick and mortar ADRC. We have physical locations people can go to access services, as well as online and through the phone. There really is no wrong door. We set up this model because it's what worked for us and for our community and what we felt was needed locally. We also are, our offices for the AAA and the ILC are right next door to each other. So we're always close in distance and able to get a hold of each other or go and bug each other in person. And as far as what we were talking about earlier with shared grants, I wanted to also mention that probably the most exciting grant that we've shared together is the Administration on Community Living Alzheimer's grant. We were able to partner in that grant and receive a position at the ILC in addition to the positions at the AAA. And that partnership has created a whole new link to services to a population that we were not able to serve at this level before. So it's all very exciting, and it's all thanks to the partnership that the ADRC creates. And with that, I'd like to go ahead and shoot this over to our special presenter from the Nevada County ADRC, Anna Acton.
Thank you very much. This is Anna Acton, one of the core partners of the ADRC of Nevada County. So I'm just going to talk a little bit about how our model works and how we coordinate services towards a no wrong door type of system here in Nevada County. So we've had a long-standing relationship with our multiple organizations throughout the community that serve older adults and people with disabilities. And we have a long history also working with our Agency on Aging Area 4, who is another core partner in Nevada County. Our goal of the ADRC is to streamline access to long-term services and supports for people of any age and with any type of disability, family members, and care providers. We have had a Community Living Implementation Council, which serves as the advisory board of our ADRC in Nevada County. And this group had been meeting for many years, even actually before we called it an ADRC. And this group would come together to discuss shared values and identify barriers to meeting local needs for individuals to remain living in the community. Our shared values include prevention of institutionalization whenever possible, honoring individual and consumer rights, and having a consumer-directed approach for services. And I'll say that these shared values did not happen overnight. It was a long, many conversations over time where we came up with these shared values and understanding of what these terms mean when working with individuals from our perspective organizations and through our respective grants and what have you. So we have many extended partners very similar to what the San Diego partnership has described. One of our key partners is really, I'll say there's really two key partners for us to realize our ADRC vision. One is 211 of Nevada County, or Connecting Point. So it was this group many years ago that came up with this idea that we needed a robust resource directory and way to connect people to all the different array of services in the community. And through time, we developed a 211 that now is housed within Nevada County. It's a 24/7 call center, and they have a lot of experience around aging and disabilities, so they end up being kind of our no wrong door entry point into the system. And then secondly is our Nevada County Social Services, and specifically the adult services, adult protective services, is also a critical partner for us. We also work with those with developmental disability through the Alta Regional Center. We have our transit providers, we have health clinics, falls prevention, hospice, home delivered and congregate meal providers, as well as a free or low cost legal services. We have some for-profit in-home providers, our local hospital, and also our Anthem Blue Cross and California Health and Wellness Medi-Cal providers. So we've really honed in on, I would say, a couple things. One is having those key referral resources, such as 211 Nevada County. It is probably daily that we get warm handoffs from 211 to Freed and to other local providers to make sure people get connected to the services they need as seamlessly as possible. And we also do trainings to help each of the organizations understand what each organization provides. So new staff can go to these trainings and know what the organization provides, what the eligibility is, so that we get them connected to the organization they can benefit from. And then we also do an annual conference around LTSS annually. So that's a little bit on our model. Let me give you, kind of try to put a little bit of a face to how this plays out. So as you know, one of the core services is transition for an ADRC. And so we focus on both the nursing home transition side as well as the hospital transition side. And in that coordination, we have Freed has a relationship with Dignity Health and our local Sierra Nevada Memorial Hospital, where we do a care transition intervention program, where we support consumers when they transition from hospital care back to the community or to a lower level of care. And we can assist consumers in completing a personal health record, which is basically where important health information is organized into one convenient pocket-sized document. We had a recent consumer who really drove home the value of this program and the portable personal health record. This individual is homeless and living out of a backpack and bags, and he was discharged from the local hospital to our local homeless shelter with reams of paper, several directions for follow-up care, and little understanding of what to do. So in our home visit, which we did at the local homeless shelter, after discharge, we reviewed his documents and organized his important health information into his personal health record. Healthcare providers, community support, medications and instructions, diagnosis, red flags, and what to do when concerns arise. He was able to easily carry his personal health record to his appointments and update or refer to it as needed. By the end of our visit, he had a better control of his healthcare and increased confidence in handling what might come up. In addition to those specific services provided by our care transition coach, we were able to address other needs that were presented and make referrals to appropriate resources to add to the consumer circle of support, which included not only his medical stuff, but also addressing his transportation needs as well. So that's a little bit of an insight into one of our core services and how we coordinate with multiple agencies to meet the individual's needs.
Thank you, Anna. Can we ask Eli Gilardin from Marin Center for Independent Living to talk a little bit about the Marin model?
Sure, happy to. Hi, everyone. How's it going? Eli Gilardin, Executive Director of the Marin Center for Independent Living and partner in Marin's Emerging Aging and Disability Resource Connection with County of Marin Aging and Adult Services. So for those of you that haven't been to Marin or know little about it, we're a small county, just 529 square miles. Sonoma County or Wine Country is north of us, and San Francisco is to our south. We're often known as the other side of the Golden Gate Bridge. Marin County is an aging population. In fact, it has the highest rate of adults turning 60 in the state, about a third of our population will be aging into disability by 2020. Another unique feature of Marin County is our cost of living. It's extremely high. So we have significant disparity across income, those that have housing, those that do not have housing. Approximately 3,000 older adults and people with disabilities in Marin are housing insecure, and another 1,000 are homeless. So with some of these significant disparities and a changing environment, Marin Center for Independent Living and County of Marin Aging and Adult Services came together back in 2014 to talk about building an emerging ADRC model. We've worked together for many years. Aging and Adult Services has funded the registry at MCIL for over 10 years, our caregiver registry. So we had a strong and existing relationship, but we really hadn't entered into the ADRC arena. And so we were starting from, I'd say, ground zero. The benefit that we did have was seeing other models that have been developed around the state. And as you heard previously, both Ventura, Grass Valley, as well as Riverside, and then more recently, Placer County, are some examples of just really strong ADRCs that we've looked at as we've built out our ADRC model. What we recognized in our early foundation of our model is the necessary and critical need for sharing resources and having a conduit between our two organizations. So in 2016, MCIL and Aging and Adult Services co-funded an Aging and Disability Resource Connection service coordinator to facilitate the building and the administration of ADRC services, enhanced information and assistance, options counseling, short-term service coordination, and person-centered transition support. As an example of the impact of what we've done over these past 2 years, since hiring our ADRC service coordinator, we've supported over 350 individual consumers, facilitated approximately 102 facility to home transitions, and provided short-term service coordination to approximately 115 individuals. We've also built strong partnerships, as we've heard earlier, with many of our other community-based providers, including the Housing Authority. One of the key components we've gotten involved in is administering Section 811 vouchers, and we were able to facilitate housing for several housing insecure or homeless consumers. Also really developing deep relationships with our healthcare providers. Over the last 6 months, we entered into a partnership with our federally qualified health center to provide person-centered care coordination and housing preservation services to individuals enrolled in whole person care through the community clinic, as well as IOPCM, intensive outpatient case management. We've also really developed deep relationships with the skilled nursing facilities, the Ombudsman's Office, in-home support services, adult protective services, as well as the coordinated entry partners involved in whole person care. It really takes a fully invested infrastructure to implement No Wrong Door. And while we're still building our model, we're very pleased with some of the results that we've seen so far. Another component that I just want to highlight is, how this impacts an individual on a local level. So I'm going to talk to you about Serena's story. So Serena is a 58-year-old female who lives with both congenital heart disease and multiple sclerosis. Serena is single and lives on her own. Due to her circumstances, she has experienced significant social isolation. Her only source of income has been her Social Security disability insurance. So in Serena's words, "I was at a post-acute facility after a heart attack and told the discharge nurse I didn't think I'd ever be safe to go home. She told me to call Julia at the ADRC. Julia came and met with me and signed me up for Meals on Wheels, paratransit, and in-home support services. She also helped me enroll at the Lifelong Adult Day Health Program. I was still scared to go home, but Julia made sure that I had the support around me every day for the first few months that I was at home. The ADRC nursing student interns also came to see me as soon as I was discharged and worked with me twice a week on my medication management and physical therapy exercises. Now it's 1 year later, and I'm still using the services Julia connected with me, including Meals on Wheels, paratransit, and the therapeutic support program. It has changed my life. So Marin's ADRC is currently moving towards state designation, and we hope to become a formally designated ADRC in the next few months. But I just want to share that, really starting from a personal relationship across the Independent Living Center and the Area on Aging is where you build that trust to facilitate the emerging ADRC, as well as take advantage of new opportunities. And just to give you an example of a new opportunity that we are partnering on, as many of us, both in independent living and aging know, CalFresh expansion has started to include individuals on SSI who would now be eligible for CalFresh. And our emerging ADRC is sharing CalFresh resources across the Independent Living Center and the Area on Aging to co-fund a new position to support the existing or the emerging ADRC work that we've started. So, as you build that trust and expand that relationship, you can move forward strategically to take advantage of other opportunities that come up, as well as build out those relationships with healthcare partners, whether it's your federally qualified health center, your managed care provider, hospitals, your housing authority. It really, again, is building out the entire infrastructure of the community to support individuals with long-term service and support needs and reduce the social determinants of health.
Thank you, Eli.
Okay, so this slide is all about the consumer. And I know Eli just shared a really great example of how a consumer has benefited from an ADRC being in place. Really beyond the opportunity to create new and meaningful philosophies for all organizations involved in the ADRC, the best part of it is the programs historically siloed by age or diagnosis can be made available to those in need. Danny, would you like to share a story from Ventura?
Sure. We've experienced many examples of this, but the most memorable so far was when the AAA housing caseworker received word of a 40-something-year-old mother and her teenage son, both with significant mental health disabilities, receiving a 72-hour eviction notice due to behavioral issues from the son. The caseworker immediately reached out to ILRC, and two of our staff, along with the AAA's case manager, became an instant team. The next morning, the team had advocated with the apartment and the eviction was lifted with the agreement that both mother and son would continue to receive supports from our organizations. Mom kept working with the AAA and ILRC, and son began working with our youth advocate. Both are still doing great, but this is an example of how we did not and could not let the fact that both were below the typical age for the AAA and their disability status stand in the way of helping serve them.
And really this also goes to show why the no wrong door system does work. If we were not an ADRC, this would not necessarily have happened, but because we have our system set up where people can go in any door. This was just one of the doors that this family happened to walk it through. So in addition to this awesome story, we've also assisted several individuals under the age of traditional requirements to receive home delivered meals they need. Also, our transportation program has benefited many younger individuals with disabilities and needing to go where they need to go. So for our transportation program, we receive federal funding through our local transportation commission, and we specifically asked for the funding to serve older adults and people with disabilities. And so we provide about 70,000 rides annually, and a number of those rides are to people under the age of 60. And so we work a lot with our local ILRC to qualify people for that program and make that resource available.
Yeah, and this is Danny again. I'm going to talk about a little bit more about how ADRC partners work together. As you've learned, I think already, ADRCs can look different depending on the local community. However, partners can work together by using a shared database, of course, sharing clients and consumers, using the shared resource directory that comprises all aging and disability resources, and having team meetings and shared trainings. The important thing is to ensure that both partners know why they want to be an ADRC. It's really all about making the change in that philosophy and viewing yourselves as a team and not necessarily two separate organizations, but one with a shared philosophy of serving.
So hopefully by now you're saying, gosh, everything sounds so great. ADRC sounds great. How do I become one? So we have a poll question for you for those who are interested or were interested in becoming a state designated ADRC. What would best describe the reason your organizations have not yet applied for designation? Great. Well, thank you for answering poll questions. We're hoping that whichever the reason for having applied in the past, we hope that this presentation and upcoming slides will provide more clarity for you to understand the planning process and the designation and application process to become an ADRC. But first, I wanted to thank you for your interest in becoming a state designated ADRC. State designation as an ADRC really reinforces a collective effort amongst partnerships throughout the state. And also establishes a brand recognition for individuals who are seeking a trusted source to learn more about the available services that are out there, make informed decisions, and access services. The first step of becoming an ADRC is really to contact the ADRC program staff at CDA to express your interest. Thereafter, CDA will work with you through what we call the emerging process, similar to what Marin County is going through right now, to plan, develop, and implement each of your ADRC components before applying for designation. As I mentioned, CDA will support you in planning, developing, and implementing the processes necessary to become an ADRC. Here are some of the steps for planning for designation. The first step being partnership development, such as establishing a relationship with the local AAA and ILC, similar to what Eli and Anna, Victoria, and Danny had mentioned. The partnership really starts between the AAA and ILC to begin this ADRC, becoming an ADRC process. Next is identifying those extended partner organizations that will make up your community's local LTSS system. Together, those core partners and extended partners would collaboratively deliver the ADRC core services in addition to any other LTSS that's deemed as a need by your community. Another good practice for partnership development is simply cross-training of staff. What we found is that it is a good way to understand the available programs and services and also build close working relationships between the organizations and the staff. Second is identification of community needs and vision for the program, such as conducting a community-wide scan of your LTSS system strengths and gaps. With those gaps, it would be good to set priorities for those systems improvements, and also identifying an advisory body to provide ongoing feedback to see if those improvements have worked or not worked. Third is establishment of roles and responsibilities. which is to say it's establishing the protocols for your warm transfers, for expediting applications and providing access to services for those individuals coming through your door. A good way to do so would be creating a MOU to identify exactly who is doing what between the core partners and your extended partners. Fourth is implementation of the ADRC core services and any other services that you determine would be a need in your community. Fifth is development of strategic plans, such as a quality assurance plan, for example, which may include gaining consumer input on how the system works or doesn't work. Another would be a sustainability plan, and also a marketing outreach plan to really tell people in the community about the value of the services you provide as an ADRC. The goal of this is by the end of the planning, development, and implementation process, the goal is for emerging ADRCs to ideally have all the components in place to begin your application for designation. So now that you've gone through the planning process, we'll talk a little bit about the application process. So again, CDA will be there to provide you technical assistance throughout not only the planning process, but also the application process. The first step is really submitting the application. So once that's submitted by the core partners, ADRC program staff at CDA would review and may also request for any additional information to make sure that the application covers all the components and all the services that you're offering. The next step is the application is forwarded to a review panel who would review and score your application. If the review panel has any questions, they may schedule an interview, a site visit, or request other information. After all that, if everything looks good, review panel approves, there will be a signed MOU between the state and the core ADRC partners to signify state designation as an ADRC. So hopefully by now you're more excited and we've provided more clarity about ADRCs and the value of ADRCs and how to become one. So we have a poll question for you. So if the question is, would you like to learn more about how to start an ADRC? Great, thank you. I'm hoping that, again, you're excited about the opportunity to learn more. If you do wish to learn more about ADRCs, you can always visit our ADRC website, attend a statewide ADRC Advisory Committee meeting, contact ADRC program staff, or even contact those designated ADRCs like Ventura, like Nevada and Marin. But we really encourage, if you have any questions and want to get started, to contact the ADRC program staff at CDA. Let us know you're interested and to get more information, and we'll walk you through that process. So so that's the end of our presentation. Now is really we're allocating the rest of the time to your questions and answers. So if you have any questions now, please feel free to put them in the chat box.
And we're going to turn it over to Megan, our webinar moderator, to walk us through some of the questions that have come through in the question and answer box, as well as the chat box. I think there's been some comments. And feel free to use that for the rest of the 15 or so minutes. Anything that came up today that you might want more information about, or anything that you would like to see in the next ADRC 102 training that you might want us to go a little bit more in detail on. With that, I'll turn it over to Megan.
Great, thank you, Christina. It does look like we have a few questions in our Q&A and chat box. Please also remember, if you'd like to ask us a question verbally, you can go ahead and hit the raise hand button, and I can unmute your microphone when it's your turn. So our first question here is from Jan, who wants to know, will we be provided with this PowerPoint?
Hi, Jan. This is Christina at CFILC. This webinar will be provided through an archive, which means you'll be able to view the closed captioning and the slides on the CFILC website. We will also be passing the link of the archive over to C4A to also use and disseminate to their membership. If you would like the slides separately emailed to you as an accommodation, please feel free to post your email address and we will forward it on to you as well. Otherwise, you can expect to see it on the CFILC website within 10 to 12 business days.
Great, thank you, Christina. Ron would like to know, are the partnerships formalized with an MOU or are they open? And how often do the partners meet?
Wilson, could you start by taking this question and then maybe we'll throw it to the local ILC and AAA representatives to talk about their specific meetings?
Sure, of course. So with the core partners between the AAA and the ILC, those partnerships are typically formalized through an MOU. And also for state designation, there's a separate MOU between the core partners and the state. In regards to MOU between the core partners and the extended partners, there's no requirement for that, but it's a best practice. And I'll go ahead and let our ADRCs talk a little bit about how they've done it for that.
Okay, sure. For Ventura, we do have the MOU between the core partners, the AAA and the ILC. For our extended partners, a lot of them we already have existing contractual relationships with an ADRC, so they're as a AAA. So there's not necessarily, we don't necessarily have an MOU with them yet. However, we're in the process of updating our database that we use right now. For our ADRC clients, we have a shared database that the AAA and the ILC use so that we can see what's happening with our clients. We're in the process of replacing that. And once we replace it, we're looking at putting our extended partners on the database, which would mean that we would require a more formal MOU with all of them in order for that to happen.
Thank you, Victoria. Eli, can you speak to what MOU you have in place in Marin?
Yeah, so we have an MOU for sharing information and working in partnership for co-funding Julia's position. One, key in terms of how we share information, we went back and forth for I think a month or so on how we ensure that we meet both the county and our independent living center standards on confidentiality. And we actually utilize a encrypted email server for Julia and her colleagues, both at the county as well as at MCIL, to share information. We also are in the process of developing a business agreement for the CalFresh program so that we can build and expand that as well.
Great, thank you. Anna, I believe Nevada County was one of the early, if not the first ADRC. What does your MOU look like?
Yeah, originally we developed the MOUs. We had a three-way partnership between the AAA, Independent Freed, and 211 Nevada County. And now we're actually looking to update those MOUs. We did one-on-one MOUs, with about 10 or 11 extended partners. And we're looking actually right now to update that MOU. And we're looking at it a little bit differently in that we hope to do one MOU to have everyone sign one MOU so that we're all on the same page with who provides what and who is, who all the partners are. So we're in the midst of updating that MOU.
Great, thank you. It looks like we have a question from Jan who wants to have the website address, I believe for the Department of Aging for that technical support. Wilson, are you able to share that in the chat?
Yes, so I just typed it back in the chat. It's the California Department of Aging website, hosts the ADRC website. So that is www.cadrc.gov. www.aging, so aging.ca.gov. And currently, CDA, we're currently looking to update our website within the next month. So you may, if you go to the website now, it may look a little bit different next month, and we're updating it to be more user-friendly and also be accessible as well.
Great, thank you. And it is in the chat box as well if you guys would just like to copy that link. Our next question comes from Brian, and it's around information sharing. How have you addressed affirmative consent juxtaposed with the time sensitivity of the need of consumers in your MOUs?
I'm going to ask, this is Christina, if Anna or Eli could take this question.
This is Eli. So as I was mentioning, it took us some time to really iron out a data sharing agreement, and it really needed to be vetted at multiple levels. The details, I'd want to refer you to our staff if you have specific questions on how our data sharing and how the encrypted email system works. But really, it starts by just an understanding at the leadership level that in order to be an impactful ADRC and really meet the needs of the consumer and the community, you have to have an open communication between the multiple service providers, both on the aging and disability side. And that even includes adult protective services, because as we know, there are circumstances where APS needs to be involved, as well as IHSS, the Ombudsman's office. So you really want to have a thoughtful and detailed series of conversations to get to that data sharing agreement. And it might look a little different in every community, but again, I'd be happy to link anyone who's interested with our folks in Marin.
Great, thank you, Eli. We have another question. Is ADRC the same as the no wrong door model?
I could go ahead and answer that one. So an ADRC is a no wrong door model that is promoted by the Federal Administration on Community Living.
Great, thank you, Wilson. Another question we have here is, we are already doing this. What do we need to do, and why should we do it to get designated as an ADRC?
Megan, I can go ahead and answer that as well. So we hope that you're already doing some of these services, if not all. With the ILCs and AAAs working together, we would be able to provide a broader spectrum of services to all people. And again, like I mentioned earlier, consumers, there's a lot of parallel services out there, and a lot of consumers who are confused and frustrated in looking for services that meet their needs and wants. And state designation, again, as an ADRC, really reinforces that collective effort amongst partnerships throughout the state, and it establishes that brand recognition for the individuals who are seeking for that trusted source to learn about those services, and make informed decisions and access those services that meet their needs. And the first step to becoming an ADRC is to contact the ADRC program staff at CDA to help establish these points of contacts and make introductions, and we can together review the steps to be designated as an ADRC.
Thank you, Wilson. Megan, are there additional questions?
Yes, we do have a few more. Is there funding associated with becoming an ADRC?
That's a great question. Wilson, do you want to go first, and then we might add on some additional comments?
Sure. So there, in regards to funding, this is always an interesting question, because with ADRC, really, you may already be providing similar services and just need to tweak or change how your services are being implemented. But in regards to funding directly for ADRCs, those opportunities may include program development funding, grant funds. Keep in mind that CDA and others are constantly looking for ways to support the implementation and operation of ADRCs. And we recognize the fact that California is behind other states when it comes to funding, as other states have already found funding opportunities for ADRCs, and we're just exploring them now. So hopefully in the next months or next year or so, we'll be able to provide more information about additional funding opportunities.
Thank you, Wilson. And in addition to that, CFILC and C4A has been working very hard to advocate for additional funding through the California legislature. And as a result of our advocacy, we do have an assembly member out of Fresno who has put in a budget ask for $5 million to support existing ADRCs as well as emerging ADRCs. That's through SB 512, that is, oh goodness, now I'm going to forget the bill number.
453.
Thank you, 453. And so hopefully as soon as we see what the governor approves in the budget, we will have additional details about funding availability. Next question, Megan.
Yes. So our next question, are there any counties collaborating with their age-friendly council on ADRC services?
Sure. This is Victoria. So in Ventura County, we are working first on becoming dementia friendly, and it is as an ADRC partnership that we're becoming dementia friendly. So Danny had mentioned earlier our federal grant for Alzheimer's, and so they're a core partner with us in that grant. Our belief has always been that you put the components in place to be dementia friendly, and then you're automatically age friendly. You're much more disability friendly as well as a county, and so we're working on dementia friendly first, and then we will be working on age friendly designation next.
Okay. Megan, are there any additional questions?
Yes, we do have another one here. It says, I'm unable to get either the AAA or the ILC on board to form an ADRC partnership. What should I do?
That's a great question. Wilson, have you fielded other calls in your technical assistance capacity from organizations that are interested but may not have local core partners that want to invest?
Yeah, actually, so as you know, current law does state that an area agency on aging and independent living center would be the core partners in developing ADRC partnerships. However, that level partnership can really vary between the aging and independent living services, as it really depends on the level of available services and resources and their service philosophies. If you need any assistance in partnering with your AAA or ILC, contact the ADRC program staff at CDA, and we'll be more than happy to work with you in forming your local ADRC partnership.
Thank you. Megan, any final questions?
We do have one more, and we have a little bit of time left, so if you have any additional questions, please feel free to send them to us in the Q&A or the chat box, or you can raise your hand and I can turn your microphone on. But the last question I have here is, what is the value of offering services in a no wrong door model?
Danny, could you take this question? What is the value of offering ADRC services in a no wrong door model?
Thank you, Christina. I'd love to. As one of our slides was titled, it really is all about the consumer. And I think that the biggest benefit of offering a no wrong door system that we've experienced is a huge decrease in the consumer exhaustion that we were hearing about quite a bit. It used to be that a consumer would call ILRC and say, you're the 8th call I've made today. I've told my story 8 times today. And at the end, every time, all I hear is, we don't do that, or we can't help you. So being able to come together with the AAA and our extended partners has given us the opportunity to decrease that problem and not only create a more welcoming and a better way of providing services to our consumers, but also increasing the education and relationship around these services and these partnerships to providers around the entire county. So that's been the biggest enhancement of services in our area since we went with the no wrong door system and really created a shared philosophy for serving everyone.
Thank you, Danny. I just want to point out that California Independent Living Centers and AAAs are doing a fabulous job in building and increasing the capacity to come together and provide services to both of our populations in a coordinated fashion. And I know I was recently in Washington, D.C. and was able to talk about what that looked like in California. And we are really paving the way for what it can continue to look like state by state and the benefits of it. So I just want to really give applause to our presenters today, Danny, Victoria, Eli, and Anna, and Wilson. This has been very valuable, and if there is anyone else still on the webinar that has a question that you'd like to ask, we have a couple minutes while you're asking any of those questions, if there is any last ones. I do want to let you know that we will have a short survey evaluation at the end of today's webinar, and I do really invite you and hope that you will add feedback and comments around what you might want in a future ADRC training so that we can continue to help build the capacity of our local communities to provide services in a collaborative way. With that, it looks like there is an additional question. I will pass it over to Megan.
Thank you. Yeah, it looks like it's quite on time, actually. Ron is asking, when will the next ADRC 102 training happen?
That's a great question, Ron. Depending on the feedback that comes through today's evaluation, we will determine if an ADRC 102 training is needed. We will also be looking at the evaluations at our next statewide ADRC advisory committee. The sustainability work group is doing a little bit of the training, and then there's also a training work group. Because we are trying to build consistency and sustainability statewide, these are topics of conversation at the advisory committee. And of course, those meetings, while they are held in Sacramento, they are also available by phone, and you all are welcome to join those. I do not have the dates on me. Victoria and Danny, or actually Wilson might actually have the dates on him if you are interested in knowing when the future meetings are. But again, I invite you to provide us feedback and comments on what you would want in a future training if there is a ADRC 102. Wilson, do you have the date of our next ADRC meeting?
Yes, so our next meeting is on July 12th. And so that's actually going to be a special meeting that's going to be posted soon. But the meetings that were already scheduled is August 16th and October 18th.
Thank you. And Wilson, if somebody wants to get on the email list to get invitations to participate in those meetings, how do they do that?
They can contact, so again, the ADRC program staff at CDA, and that email address is, sorry, I don't remember off the top of my head anymore, is adrc@aging.ca.gov.
Wonderful. Thank you. All right. It doesn't look like there's any additional questions. So again, I want to thank everybody for participating today. We do want to offer additional trainings if needed and wanted. So please provide us your feedback today. With that, is there any final comments from any of our presenters today? Great. Thank you all so much.